Panic attacks are sudden episodes of intense fear. They can be very frightening. You may feel like you are losing control. You might even think you are having a heart attack. Panic attacks have many physical symptoms. These can include a racing heart, sweating, and dizziness. You may also experience shortness of breath and chest pain. Mentally, panic attacks can cause feelings of unreality and detachment. Fear of dying or losing your mind is common. These symptoms are very real and very scary. Remember, a panic attack is your body's fight or flight response in overdrive. It is important to seek help if you experience them. Panic attacks are more common than you might think. Many people experience them at some point in their lives. You are not weak or flawed for having them. There are many misconceptions about panic attacks. Some people believe they are a sign of weakness. Others think they mean you are going crazy. This is simply not true. Panic attacks are a medical condition. They can be treated effectively with therapy and/or medication. Don't let shame or stigma prevent you from seeking help. Remember, you are not alone. Millions of people understand what you're going through. Reach out for support and information.
Panic attacks can stem from a combination of factors. Biology plays a significant role. Genetics can make some individuals more susceptible to anxiety disorders. Chemical imbalances in the brain also contribute to panic attacks. Neurotransmitters like serotonin and norepinephrine are involved in mood regulation. Imbalances can disrupt this delicate balance, leading to anxiety and panic. Certain medical conditions can also mimic the symptoms of a panic attack. Thyroid disorders, for example, can cause racing heart and anxiety. It's essential to rule out any underlying medical causes with your doctor. Understanding the biological underpinnings of panic attacks is crucial. This knowledge helps to reduce self-blame and empowers individuals to seek appropriate treatment.
While biology lays the groundwork, psychological factors often act as triggers for panic attacks. Stress is a major culprit. When we experience chronic stress, our bodies remain in a heightened state of alert. This can make us more susceptible to panic. Underlying anxiety disorders, such as generalized anxiety disorder or social anxiety disorder, can also manifest as panic attacks. These disorders involve persistent and excessive worry, which can contribute to feelings of panic. Past trauma, such as abuse or a traumatic event, can also make individuals more vulnerable to panic attacks. The experience of trauma can leave a lasting impact on the brain, making it more reactive to stress and fear. It is important to address these underlying psychological factors to manage panic attacks effectively. Therapy can provide tools and strategies to cope with stress, anxiety, and trauma.
Section 5. The Outside World, Environmental Factors and Panic Attacks. Our environment and lifestyle choices can also play a role in panic attacks. A fast-paced, demanding lifestyle can contribute to stress and make individuals more susceptible to panic. Substance use is another significant factor. Stimulants like caffeine and nicotine can trigger or worsen panic attacks. Alcohol, while initially appearing to calm anxiety, can actually disrupt sleep and increase anxiety in the long run. Lack of sleep is a common trigger for panic attacks. When we are sleep deprived, our bodies and minds are less able to cope with stress. This can lead to a vicious cycle of anxiety and poor sleep. Making positive lifestyle changes, such as reducing caffeine intake, getting enough sleep, and managing stress, can help to reduce the frequency and severity of panic attacks.
Section 6. The physical manifestation. Recognizing a panic attack. Panic attacks manifest in a cascade of physical symptoms. Your heart may race or pound in your chest. You might experience shortness of breath, feeling as though you can't catch your breath. Dizziness, lightheadedness, and feeling faint are also common. You may feel a choking sensation or chest pain, mimicking the symptoms of a heart attack. Other physical symptoms include trembling, sweating, nausea, and abdominal distress. You might experience hot flashes or chills, and your hands may feel numb or tingly. It's important to remember that these physical symptoms are caused by a surge of adrenaline, your body's fight or flight response. While they are unpleasant, they are not dangerous in themselves. Section 7. The mental anguish. Fear and anxiety during a panic attack. The physical symptoms of a panic attack are often accompanied by intense fear and anxiety. You may feel like you are losing control or going crazy. The fear of dying is common during a panic attack. You might worry that you are having a heart attack or some other life-threatening medical emergency. Some people experience derealization or depersonalization during a panic attack. Derealization is a feeling that your surroundings are not real, while depersonalization is a feeling of being detached from your own body. These mental symptoms can be just as frightening as the physical ones. It is important to remember that these feelings are temporary and will pass. Section 8. The ripple effect: how panic attacks impact your world. Panic attacks can have a significant impact on your daily life. You may avoid situations that trigger your anxiety, such as crowded places or social events. This avoidance can lead to social isolation and interfere with work, school, and relationships. You might worry about having a panic attack in public, which can make it difficult to enjoy social situations. Panic attacks can also take a toll on your self-esteem. You may feel ashamed or embarrassed about your anxiety, leading to feelings of inadequacy or low self-worth. It is important to seek help if panic attacks are interfering with your life. Treatment can help you to manage your symptoms and regain control of your life. Section 9. Connected conditions: panic attacks and other mental health issues. Panic attacks often occur alongside other mental health conditions. They are a common symptom of anxiety disorders such as generalized anxiety disorder, social anxiety disorder, and panic disorder. Depression is also frequently linked to panic attacks. The two conditions can fuel each other, creating a vicious cycle of anxiety and low mood. Substance abuse disorders can also co-occur with panic attacks. Individuals may use drugs or alcohol to self-medicate their anxiety, but this can actually worsen symptoms in the long run. It is essential to seek professional help if you are experiencing panic attacks and other mental health concerns. A comprehensive treatment plan can address all of your symptoms and improve your overall well-being.
Section 10. Finding relief: coping strategies for panic attacks. While panic attacks can be incredibly distressing, there are effective strategies to cope with them. One technique is deep breathing exercises. When you feel a panic attack coming on, focus on taking slow, deep breaths. Another helpful strategy is to engage in grounding techniques. This involves focusing on your senses, what you can see, hear, touch, smell, and taste. Grounding techniques can help to bring you back to the present moment and reduce feelings of panic. Challenging negative thoughts is also crucial. During a panic attack, your thoughts may race with worst-case scenarios. Try to identify and challenge these negative thoughts, replacing them with more realistic and positive ones. Remember, coping strategies take practice. Be patient with yourself and keep practicing these techniques to manage your panic attacks effectively.
Section 11. Hope for the future, prevention, and a brighter tomorrow. While panic attacks can feel overwhelming, there is hope for prevention and a brighter future. Early diagnosis and treatment are crucial in managing panic attacks effectively. Identifying your triggers is essential. Keep a journal to track your panic attacks and note any potential triggers, such as stress, certain situations, or physical sensations. This awareness allows you to develop coping strategies and avoid or minimize triggers. Stress management techniques, such as exercise, relaxation techniques, and mindfulness, can help to reduce your overall anxiety levels and make you less susceptible to panic attacks. Remember, you are not alone in this journey. Reach out to mental health professionals, support groups, and loved ones for support and guidance. With the right tools and support, you can overcome panic attacks and live a full and meaningful life.